Aloha guys, Dr. Tom is coming at you once again. Today we're going to talk about the sensory system and our special senses. It's a long one, it'll take 2 videos. Sensory system allows us to experience the world. External information like the sound of a dog yapping, barking. Internal information like changes in blood pressure. Cells that detect stimuli. The receptor, specialized area of a sensory neuron that detects a specific stimulus, like chemoreceptors, measure blood pH, pain receptors, nociceptors they're also called, that register pain, thermoreceptors monitor heat, mechanoreceptors, like in joints that keep up with how much they're bent, photoreceptors like the rods and cones in our eye. 4 components of sensation. First, we have the stimulus. Now here they're using vision as an example. So light coming from the sun is the stimulus, goes through to the photoreceptors at the back of the retina. We're going to go over this all in detail. Rods and cones are the names of those cells. They're stimulated. They send their sensory information or their nerve signals via the optic nerve, cranial nerve 2, back to the occipital lobe of the brain where it's processed as vision. So stimulus, the receptor, rods and cones, sensory nerve is cranial nerve 2, and the brain is what actually does the seeing. Guys, out here in the world, it's just light. It's our brain that determines colors and that it's the sun and this green hillside and stuff like that. I could go into that in some detail because I've written about it. 2 characteristics of sensation: projection and adaptation. Projection. The brain refers sensation back to its source. Like in this case, you mash your thumb, something that I'm pretty good about doing. Or phantom limb pain. You may have never heard of that. People who have had a limb that had to be amputated or was accidentally cut off, they often have sensations like itching and stuff in the phantom limb. And some of them, it's a real problem because it starts getting on your nerves after a while, and you can scratch the empty air and it doesn't do any good. Adaptation. With continuous stimulation, sensory receptors become less responsive. Perfect example of that is you go get in a hot tub. At first it's scalding hot, and after you've been in a while, it seems like it's just kind of warm. You've adapted to the heat. Receptors vary in their ability to adapt. Smell and temperature receptors adapt well. Pain receptors do not adapt at all. Now guys, you might think pain is a terrible thing, and it can be. But also too, if we didn't have pain receptors or pain monitors, we'd be injuring ourselves and stuff all the time. Just getting uncomfortable from sitting in one position for too long and making us shift. It helps keep circulation going and stuff like that. I mean, it's just unbelievable how important that kind of thing is. The 5 general senses are pain, touch, pressure, temperature, and proprioception, which we mentioned when we talked about the cerebellum. Proprioception is knowing how you're positioned in space without having to look. So here's an example of proprioception: pain, touch, heat, cold, pressure. All very important. We have a very extensive network of sensory nerves, specialized structures that detect all this stuff. Pain receptors are also called nociceptors. Consist of free nerve endings stimulated by tissue injury, chemicals, tissue hypoxia, lack of oxygen. Widely distributed throughout the skin, viscera, and other internal tissues, do not adapt. I guess not, guys, but people who are in chronic pain, they suffer, but they tend to adapt somewhat, I think. So I don't know that I would entirely agree with that. Maybe it's psychological. Maybe physiological, the nerves never change, but how you're able to cope with it, I think, does some. The skin, I guess, has an enormous number of free nerve endings in it that detect pain. Now, there's also what's known as referred pain, and this is very common and very important in healthcare because the symptoms of referred pain can often help you diagnose what's going on. For example, problems in the heart, like a potential heart attack or a blockage of one of the coronary arteries, can cause pain to radiate into the left chest and down the left arm. This is famous for that. Liver and gallbladder, according to this, I didn't know this, can refer pain. Problems there can refer pain to the right shoulder. Cholecystitis, pancreatitis right here. Now, the cholecystitis is the gallbladder. It's just about in that area, but the pancreas goes across. Appendicitis. But I don't know that I would consider appendicitis referred pain because it hurts right there where it's at. So I don't know. Okay, gallbladder attack may present with shoulder pain. This referred pain, guys, is real important, though. Very commonly, a person has numbness and pain in their arms, and it's coming from a pinched nerve up in their neck, for example. Okay, touch and pressure receptors. Touch is tactile receptors, mechanoreceptors. Just think of mechanical stuff, mostly found in the skin. Pressure receptors are also mechanoreceptors, located in the skin, subcutaneous tissue, and deep tissue. Why? It's important, guys, not to undergo sustained pressure. It can damage nerves, it can inhibit circulation, ultimately cause tissue death. So we have all these things is to make us aware so we can shift. Thermoreceptors detect heat and cold. There's actually different ones for each one. Located in free nerve endings and other specialized sensory cells in the skin. I remember one of them is called a Crossus in bulb. Detects cold, but you don't have to know that. Quick adaptation. Or like the other day, I went swimming at Ko'olina, and it's in the spring. It's a little bit cold, and it's pretty chilly when I first got in. Plus, it was windy that day. But after I've been out there bobbing around for a while, it didn't bother me as much because I adapted. Temperature extremes experienced as pain. Proprioception, sense of orientation or position in space. There are receptors that detect that, located in muscles, tendons, joints, and the inner ear. Why? It tells, and of course, the inner ear, guys, deals with balance and equilibrium. Sensory information, most of it goes to the parietal lobes and the cerebellum. Most of it goes, I don't know what this is, parietal lobes and cerebellum. Okay, now we have what are known as the special senses. And this is usually a category all of its own. It sort of is here. And they are the sense of smell, the sense of taste, vision or seeing, hearing, and balance. Yeah, normally balance is not considered a special sense, but it's associated with hearing, and which is, so, you know, maybe it's okay to include that there. I don't recall, like if you take a class in higher anatomy and special senses, I don't know that. I guess it will. I don't know. Olfactory is smell. Remember that word. There are chemoreceptors in the nasal tissue. Nerve impulses travel cranial nerve 1, olfactory nerve, to the temporal lobe for interpretation. Scientists say that, that the sense of smell is the first thing that developed as animals were evolving over billions of years. And it's the deepest, and in the deepest part of the brain is where the nuclei for that are. Depending on your belief system, of course. Okay. Gustatory is taste. Taste receptors are also chemoreceptors. Nerve impulses move along 3 different cranial nerves. I think it's 5, 7, I forget the other one. To parietal and temporal lobes, where it's detected. We have taste buds for bitter, sour, salty, and sweet. There's also another one that has a Japanese name that's been discovered in recent years, but I don't know. I don't remember it. I don't know how to pronounce it. A great deal of taste, too, guys, is from smell. Actually, if you notice that if you have a cold or sinus problems where you can't smell very well, you hardly can taste anything either. Sight and hearing. Now, these are, of course, vision is the biggie. It's extraordinarily complex. Sense of sight, the eye. Visual accessory structures, primary visual structures of the eye and the visual pathway. Okay. Visual accessory organs, the eyebrows, the eyelids, the eyelashes, the covering across the eye called the conjunctiva, and the lining of the eyelids also is that. Eyelashes, lacrimal apparatus that produces tears. Extrinsic eye muscles. Now we have extrinsic and intrinsic eye muscles. The extrinsic are the ones that roll the eyeball around. Now remember, there are 3 separate cranial nerves that play a role in that. That's how important it is. The inside edge is called the medial canthus. The outer edge is called the lateral canthus. Tears are produced. They wipe across and they drain down the lacrimal sac and go in the nose. That's why if you get all teared up and emotional, you often get a runny nose too. These things, guys, most of them are to protect the eye, like the eyelashes and eyebrows, to keep particulate matter and stuff like that out of it. The eye has to be moistened. That's what the lacrimal apparatus does. The eyeball has 3 layers: the sclera, which is the white part, choroid, and the retina, which is actually part of the brain that's positioned at the back of the eyeball. Yes, a portion of the brain projects into the eye. And when you look in the eye with an ophthalmoscope, you can see it. It's the only part of the brain that can be seen without making an incision in the body. The sclera, a tough outer layer and a posterior eyeball. Forward extension becomes the cornea. Cornea is real important. It's a clear covering over it. But also, guys, the white part of the eyeball is called the sclera too. Extrinsic eye muscles attach here. That's what they're showing here. Pupil is what lets the light in. We have a lens in the eye, much like you'd have in a camera, that focuses the light rays coming in. The retina is back here with the photoreceptors. The purpose of the cornea and the lens and the pupil is to focus the light ray where it comes to a sharp focus right on the retina, not in front of it or not behind it. Okay. Here's the sclera, choroid, retina. Optic nerve, cranial nerve 2. Okay. The choroid, middle layer in the posterior eyeball. In the posterior eyeball, forward extension becomes the ciliary body in the iris. The iris is the colored part of the eye. The ciliary body, I think, what does it? I don't remember. I don't think it produces tears, but I want to say it does. Highly vascular to nourish the retina. Okay. Remember, the retina is part of the brain. Inner layer in the posterior eyeball, site of photoreceptors. We have 2 kinds of photoreceptors in the eyeball: rods and cones. Cones are what detect sharp vision and color vision. Rods help us see in darkness and peripheral vision. At the very back, where the optic nerve comes in and out, it's called the optic disc. And it's part of cranial nerve 2, which is the optic nerve. Optic nerve is purely sensory and in nature has no motor function. Retinal photoreceptors, rods, are located on the periphery, responsible for black and white or night vision. Cones are located on the central part, concentrated in the fovea centralis, which is the area of the retina where the most sharp vision occurs. The center of the macula lutea. We'll talk about that in a minute. Responsible for color vision. There are very large numbers of these guys back there. And when light strikes that electromagnetic, or a visible light. Guys, the electromagnetic spectrum is gigantic. Microwaves, X-rays, radio waves, TV, all of that is light. But the part we can see out of this enormous spectrum is only a tiny little bit. It's called the visible spectrum. It's 400 to 700 nanometers. I see you didn't think I remembered that. So most of the light we cannot see. Okay, there are 2 cavities in the eyeball. There's an anterior cavity and a posterior cavity. The anterior is between the lens and the cornea. Contains a watery liquid called aqueous humor. The posterior cavity contains a jelly-like material called vitreous humor. I think that's... Now, this aqueous humor is real important, guys, because if it doesn't circulate properly and it doesn't drain properly, you can have a serious disease called glaucoma, which can cause blindness. So it's the ciliary body forms aqueous humor. I said tears. I couldn't quite remember. Circulates through the pupil behind the cornea, drains through the canals of Schlemm. Now, I'm sure you all know what the canals of Schlemm are, right? That is the name of it. The canal of Schlemm. If it gets plugged up, guys, and doesn't circulate, it builds up in there and it squishes. Okay, time is up. We'll continue next time. Dr. Tom signing off.